Tonight on Headline Humboldt, we hear from a local reporter whose shoe leather journalism has revealed some difficult truths about Humboldt County's COVID response. Also, a man was killed near Arcata this week after residents called in to report him wandering the streets and allegedly brandishing a firearm. Coming up next. This is Headline Humboldt. I'm James Falk. Thanks for joining us. It's one thing to talk in the abstract about the surging cases of COVID-19 across the country and here in Humboldt County. Yes, the numbers are startling, and if we all squint our eyes a bit and exercise our natural instincts for compassion, it's certainly not impossible to connect those spiking numbers with real lives and real repercussions. But beyond the official story released by Public Health and the at times dramatic exhortations coming from elected officials, we mostly haven't heard how these spiking numbers are being felt by people on the ground. Especially in these past few weeks, as the Delta variant has clobbered the North Coast and sent infection rates and the death toll skyward, those impacts on the men and women on the front lines have been real and they've been painful. Tonight, our guest, more than anyone else in the local news business, has worked hard to break through the normal bureaucratic barriers that keep a lid on those stories. By cultivating a wide source list and protecting their identities, she's been able to reveal the ground truth on how Humboldt County and area hospitals are actually doing in the ongoing battle against COVID-19. Reporter Ryan Hutson, whose work has regularly appeared in the Redheaded Blackbelt news site, will join us shortly to share some of the insights she's been able to gain. For so many of us, it's baffling that we're suffering through a pandemic that has such a readily accessible solution. We hear again and again from our public health authorities that the only real way to come back from this last horrific 18 months is by getting as many people as possible vaccinated. Even our septuagenarian President Joe Biden seems to have lost patience with the vaccine and mask resistant in this country, and he's actively searching for ways to force the issue. As individuals in Humboldt County and elsewhere weigh the pros and cons on getting their jab, perhaps they might consider the stories of people on the medical front lines risking their lives every day to help their fellow citizens survive something that may well have been entirely avoided. Now, the interview. Ryan Hutson, it's a privilege to have you on the show tonight. Thanks for beaming in. Can you hear me?
Yes. Hi, James. Thank you for having me.
No problem. It's like I said, it's our privilege. So let's start from the beginning. I mean, you're a contributor with Redheaded Blackbelt, is that right?
That's right.
So
yeah.
Can you describe what that is for people who don't know and maybe we want to check it out?
Sure. Redheaded Blackbelt is an online news source, mostly covering local news around the Humboldt County region, but expanding all over the Emerald counties, as we like to say. Mm-hmm. Run by Kim Kemp at kimkemp.com.
Okay. Now it's sort of, I mean, one thing I've noticed about Redheaded Blackbelt is it's Johnny on the spot. A lot of times when other news agencies are just starting to hear word of something, it's already appeared on kimkemp.com. How do you guys do that?
I would have to say it's a trick, but there are other people involved. It's not always me on the scene. We've got Sure. Mark McKenna. He's always fabulous behind the camera. So he's a real asset to the Redheaded Blackbelt.
Yeah, I've known Mark for years. We used to work together at the Time Standard, as a matter of fact.
Yeah. So yeah, he's sort of prolific in Humboldt County and beyond even, especially with the fire coverage recently. Yeah. That's one thing that has really taken the Redheaded Blackbelt sort of beyond Humboldt County and even immediately neighboring areas, sort of now down to Ukiah, all the way up to Crescent City, all the way through Trinity County now with the fires expanding. It sort of draws the coverage,
Yeah. One thing that I've noticed in particular is that you guys seem to provide a news voice for areas and regions of this county and other rural, neighboring places that don't typically get covered.
I think that's a goal, coming from a small community. Kim Kemp is sort of geographically isolated, and I think that it's important for rural people to have access to information and current information, especially breaking news. It's always sort of difficult when you're isolated to access breaking news, frankly, what's going on. Radio has always been helpful. KMUD down in Garberville has been instrumental in that region. And so Kim Kemp sort of is also filling that void of news for those communities.
Yeah. I mean, people may not know, but she was originally with Lost Coast Outpost, and now she split off, and we have two functioning news websites, which a lot of communities haven't even really got off the ground yet. So I think we're leading the pack in that regard. So thank you for your hard work. But the reason why you're on the show is because of your coverage of the COVID crisis. So starting generally, how well do you think Humboldt County is doing handling the COVID crisis?
You know, I think everybody is struggling. Humboldt County is not doing great, you know, in comparison to neighboring areas. In some respects, we're doing a little better per capita, but honestly, the data is sort of hard to suss out. On any given day, if you compare the county data provided by local dashboards, say, compare that to a state dashboard, there are discrepancies. So the way the data is rolled out and filtered and provided to the public has not been fluid, has frankly caused some confusion. And I tend to think that without a lot of transparency in data, it just sort of creates room for speculation and therefore misunderstandings. And so that's one thing that I've tried to focus on in my writing and reporting, is trying to clarify the data, trying to hone in on the current situation at the time.
Do you think that that effort to sort of keep things clinical and behind, you know, the dashboard or behind the sort of vague numbers, is that on purpose, or is there just a lack of, you know, ability on the part of county officials to kind of keep things current?
Oh, I get the distinct feeling, and it's not just a feeling, I shouldn't say that. The health officials locally really are saying that they have a really difficult time simply manning the helm, so to speak. Assessing the data is a big chore. There's just an immense amount of data, and they have a hard time just getting it out there in a way that's palatable to the public in an efficient way, is what I'm getting.
Yeah. One of the things that came up in the press conference today, and we've heard in the past, is that Humboldt County is doing slightly better than Del Norte County to the north. Is there any reasons that you can attribute to that? Is it just because it's a smaller county with less resources, or?
It's hard to say. I mean, I don't do much reporting north of Humboldt County. I read a little bit about Del Norte and what's going on up there to get sort of a perspective here. You know, in Humboldt County, they've put a big emphasis on the educational approach of reiterating why people should mask, why social distancing is important, basic preventative measures. So I think that has a lot to do with it. And I think I've seen a lot of evidence that people take it seriously. You know, I know there are corners of the county where that varies, frankly, a lot. So depends on where you are.
Absolutely. Do you have any sense, I mean, I know you have a sense. Basically, you've cultivated these sources who come from, you know, the sort of the ground level of our county's reaction to COVID. Who are you speaking with? I mean, obviously you don't want to give up their names, but can you give us a sense of who they are in terms of, you know, which agencies, which positions, so we can get a sense of their perspective?
I can a little bit, yeah. I mean, generally, these are community members. These are friends and neighbors and family members that also happen to work in the healthcare industry locally. So I would start with that, you know. Yeah. But they do range. I've heard from people, you know, from environmental services, you know, housekeeping, to a couple doctors off the record. Wow. You know, so specialists in between, people who work in the tech aspect, and all kinds of nurses.
Yeah. Is there any consistent message that you're hearing, or is it sort of all over the map depending on where they come from?
I mean, the people who work in the healthcare industry are primarily explaining to me that, you know, nobody expected to be here still. At this point in the pandemic, they thought that we would have turned a corner by now, either with vaccination or with a combo of vaccination and natural immunity, which just has not added up. So with the combination of, you know, a lack of immunity in the community, community immunity, I like to say that, with a lack there, and also the Delta variant being really contagious, is very formidable. We're at a deficit, you know. So nurses and people in the healthcare industry have reiterated again and again, they need help, they need staff, they need more people, they need more hands on deck. And the pandemic has just sort of put a microscope on that, and COVID is really exacerbating an already sort of stretched thin situation, according to nurses and healthcare professionals and union reps alike. So it's a widespread problem. And also, this is not just in Humboldt County, this is across the board. So yeah.
In our conversations pre-show, you mentioned that as people will see coming up at the press conference, they talk about triage within the local healthcare industry, that they're having to make hard choices now about who receives care and when based on their resourcing. But you pointed out that that's been happening for a while. Could you reiterate?
Yeah, you know, based on interviews I've been doing for the past few weeks, and mostly in the middle part of August, people I spoke with were describing having to, you know, make difficult choices about how they spend their time in caring for patients. Do they go here? Do they go there? You know, there just are not enough of them going around, and that causes them to, you know, for instance, be late delivering medication to one person or another, or delay providing a bed to a transfer patient, or things of those nature. Yeah.
You know, the hospital is bearing the brunt of this. Providence St. Joseph Health. I'm not even sure how to title it anymore. It's evolved over time, but Providence St. Joseph is bearing the brunt of this. According to your sources, how well have they responded as an institution to the shortages that you've talked about and just the overall you know, calamity that's unfolded?
Well, you know, unfortunately, according to the people I've spoken with, they're not responding well. I don't get the feeling that there has been a diligent effort to listen to the healthcare workers who are expressing these needs. I'm not there. I can't say that I'm not in those boardrooms. I don't go to those meetings, obviously. But people who do, you know, have access to that information are saying that they are still trying to have that conversation. So things are not going smoothly. Yeah, and I know that they have requested more staff, and about a couple weeks ago, I got an email in response to some questions to St. Joseph's that did indicate that they had borrowed beds and borrowed some equipment from neighboring hospitals, and had asked for staff assistance from the state. So, you know, there are efforts being made. I just don't have confidence, based on what I'm hearing from healthcare workers, that those efforts are panning out and really making a dent. So yeah, that remains to be seen.
I saw that in your reporting that at some point you talked about, I think it was locums and then also traveling nurse staffing. Has that come to pass that you know of?
The traveling nurse, the complication with getting traveling nurses is also a pre-existing issue. The hospital has always relied on traveling staff.
Yeah.
So it is complicated, but it's also further exacerbated again by the COVID and the pandemic, because again, we're not the only location needing additional staff at the moment. Many places are surging, and in addition to a surge, you have hospital staff just simply quitting or retiring in large groups and quantities all over the nation. So even that sort of backup pool of reinforcements is just not there.
What do you think is the most important thing that people ought to know about how our local health officials and the workers on the front lines, how they're faring right now? What do you think that the public is largely missing out
on? What I'm told repeatedly is they really want people to be safe and not end up in the hospital, frankly, right now, because there are not enough resources. But beyond that, they wish that people, generally speaking, there's a desire that people get vaccinated, because that's, as one nurse put it to me, anonymously, sure, if I'm going to go through the windshield, I may as well have my seatbelt on. So that's the thinking right now, is that the Delta variant is so pervasive that it's almost a given that it's just a matter of time before one of us contracts this particular variant, and there is then the likelihood of ending up in the hospital, especially if you're unvaccinated. So to save the resources, just get vaccinated. That would be the bottom line that I keep hearing again and again.
Yeah. You know, I think I've mentioned this to you before, but the use of anonymous sourcing can be fraught with a little bit of controversy now and then. But it's especially important, I think, in issues like this, where people have real burdens to coming out and saying stuff like this publicly. What's been your thinking in the last minute that we have tonight to sort of about that, using you know, anonymous sourcing to get at the deeper story?
I'm glad you asked. I mean, I would obviously prefer to be able to put a name to a source, and there's that much more, you know, seemingly validity to it. But an anonymous statement provided by a legitimate source, especially when it's been verified multiple times over, is just as valid. And I get better feedback, frankly. When people feel comfortable and free talking to me, then they can say what they want, and they know that I'm not going to, you know, compromise the integrity of their statement or give away who they are. So it allows them to then voice their concerns. And I honestly don't think I'd be getting this feedback if they were able to voice this in a more productive way within a structure that was built to address these concerns.
Absolutely. Well, thank you very much, Ryan, for joining us. I hope to see you back here. I love your work, and I look forward to highlighting it in the future.
Thank you. I appreciate that.
Have a good weekend.
Thank you. You too.
We'll be right back after this short break.
Lion Air Flight JT610 went missing from radar.
And then the second plane crashed.
A new piece of software.
This was going to be an existential crisis.
They had no idea how powerful MCAS was.
The regulators.
FAA's oversight was sorely lacking.
And the company.
Why didn't you do it from day one?
Mr. Chairman, if back then we knew everything that we know now, we would have made a different decision.
A Frontline New York Times investigation.
At a press conference this week, public health officials were blunt and at times emotional about the state of Humboldt County's COVID response. Public Health Director Sophia Pereira said county healthcare providers now have to prioritize some conditions over others as the COVID surge drains local resources.
As you're all well aware, we are seeing the worst of this pandemic that since the very beginning of it. And we are in an emergency. And so we are seeing a surge in our hospitals. We are seeing a surge in deaths in our community. And the impacts of this surge go beyond the walls of our local hospitals. We are having to triage just like our hospitals are triaging. Our top priority is to reduce the impacts of COVID-19 to keep people alive and healthy. And still to this day, getting vaccinated is the best tool to achieve this goal. So again, I want to encourage folks that are eligible to get vaccinated that haven't done so yet, please get vaccinated. And the state has been incredibly generous we've been working closely with them from the very beginning, and they have been really key partners in the surge that we've been experiencing now. And so I just really want to express our gratitude for our state partners within CDPH and EMSA. And I think, as we all are well aware, that we are not the only community that is surging. So we are competing for resources, staffing resources at a local, state, and national level for both medical and non-medical trained staff. And because of these limitations, we are needing to make changes to our contact tracing, to our dashboard, and Joint Information Center. These are things that are getting impacted based on these limitations.
Public Health Officer Ian Hoffman said the good news is that our case numbers have hit a plateau in recent days. The bad news is that those totals are still quite high.
As Sophia said, this is an extraordinarily difficult time for our community. We have seen the most deadly month yet of COVID through the month of August. The arrival of the Delta variant, certainly brought this right to our doorstep in a way that, we had been watching around the world and thought might not happen given the arrival of vaccine, but here we are with this happening right in front of us. And we're all working to try to slow this and do what we can to mitigate and triage the damages from this current surge. It's difficult work, and all of us are working hard to do it. The hospitals here at Public Health and everyone in the community. I read an article about Del Norte and large store up there that was dealing with 2/3 of their staff out of nearly 300 staff. 2/3 of them were out on sick from either COVID or COVID-related illness in their family. It's difficult to run a business that way, and I think we're all dealing with that here, the hospitals, public health, and also all of our community members. So it's important for us to remember that we're all working really hard to keep things moving and keep society functioning throughout this very difficult time. Current status of our cases for Humboldt County is that we have seemed to likely hit a plateau over the last few weeks, but that plateau is very high. So there's still extremely high number of cases happening each day and weekly. And we haven't yet seen signs that we've come out the other side of that plateau, and we're not yet starting to see a decrease in overall cases.
A man was shot and killed this week by police after residents called in to report him wandering around the streets and allegedly brandishing a gun. The shooting will now be investigated. Excuse me, my mistake.
At approximately 10:47 this morning, the California Highway Patrol received a 911 call from a reporting party that indicated there was a person that was walking on Hyndon Road near Miller Road here in unincorporated area of Arcata Bottoms, who was described as a white male adult in his 30s, leather jacket, and in possession of a firearm. California Highway Patrol immediately dispatched units to this area. They requested assistance from the City of Arcata Police Department, and units arrived on scene at approximately 1100 hours this morning. They looked in the area, and approximately 11:05 located the suspect, matching the description, black leather jacket, white male adult, 30s, in the area of Mad River Road, approximately the 1000 block. They exited their vehicles and they contacted the subject, who was armed with a firearm. And at that point in time, they tried de-escalation techniques. They tried to speak with this person. This person ignored the commands and the instructions to drop the firearm. They then followed the subject on Mad River Road into the 1100 block, at which time the suspect brandished the firearm. An officer-involved shooting then occurred, and the suspect was down. They took him into custody. Immediately life-saving efforts were performed. Emergency medical services were dispatched. Fire paramedics were on scene, transported the subject to a hospital and the suspect was pronounced dead at approximately 11:57 this morning at an area hospital.
Humboldt County Sheriff Will Hansel went on to say that the shooting will now be investigated by the Humboldt County Critical Incident Response Team, which is made up of area law enforcement representatives and the State Department of Justice. The deceased man has yet to be identified. For once, after years of tight spending and numerous cutbacks, the budget news out of Humboldt State University is looking up. Proactive planning and smart resource management took credit this week for the fact that HSU's operating fund budget is balanced for the first time in more than a decade. In a letter to the community, HSU Budget Director Amber Blakesley said the university still struggles with under-enrollment and the ongoing impacts from the COVID pandemic. But the school's transition into a polytechnic university has allowed the institution to get back on its financial feet. HSU's 2021-22 operating fund revenue budget is $133.6 million. I think it's safe to say that otters are cuter than just about any other critter in the world, and I'm not the only one who thinks so. In fact, to raise awareness about otters and support otter research, the North Coast Otters Public Art Initiative is hosting an in-person silent auction of 32 otter sculptures decorated by local artists tomorrow from noon to 3. This will be followed by an online auction of the remaining otter sculptures the following week. The silent auction will be held at Clark Plaza across the street from the Clark Museum at 240 E Street in Eureka. Vice President Kamala Harris was in California this week campaigning with Governor Gavin Newsom to stave off an effort to recall him. At a rally held in Oakland, KEET Executive Director David Gordon was in attendance and managed to capture these up-close photographs of both the Vice President and Newsom. As for the recall itself, Headline Humboldt will be live on the air this upcoming Tuesday to bring you results. It's been a long and bumpy road, so remember to look for us at 7:57, 8:57, and 9:57 p.m. for election night numbers and analysis. It was 20 years ago tomorrow that I was a young cub reporter for the Eureka Times-Standard when managing editor Connie Rux called in everyone early. Planes had just flown in to the World Trade Center. I was sent to the Arcata-McKinleyville airport to interview shocked employees, frightened passengers, and flushed-faced deputies who had just arrived to secure the scene from the suddenly deadly threat of global terror. With the resulting war in Afghanistan now over, it's important to remember the 2,977 who died that day, the 2,448 service members who died in that war in Afghanistan, and the untold tens of thousands of Afghans, Iraqis, U.S. contractors, and allied troops who also gave their lives over these past 20 years. May it never, ever happen again.